So now we're looking at a little bit of basics and some terminology. Now we'll get to diagnosis of what the patient is presenting you with. It's the nature and the cause of a disease or injury. And dentistry is fantastic at describing the nature, especially in temporomandibular disorders. We're very, very good at describing the nature of the disc displacement, whether or not it reduces the degree of pain that the patient is in. We're not going to talk about normal anatomy and normal physiology. Something abnormal is going on that we're going to describe. So the patient's presentation is going to have abnormal anatomy and or pathophysiology. The nature of the diagnosis in our world are anatomic deviations, that'll be the signs, subjective reports like the symptoms, joint derangements, muscle conditions, occlusal classifications, types of pain. So we're reading Dental Town posts and saying, well, what's your diagnosis? This diagnosis is anterior placed disc with reduction and pain. What's your treatment? They start treating the signs that they just described. Well, I got that. I got anterior disc displacement with reduction. You're gonna treat me? Well, yeah, you're gonna die someday of that. Well, it's been 30 years, not yet. The other half of diagnosis is the cause. How something got that way, or how something is staying that way. So when I got hit by a basketball in my jaw when I was a junior in high school, and I ran down the car, I was like, what the hell going on? I couldn't call on. You can't treat that anymore. That was a long time ago. I got a click now. I have parafunctional control all the time. So how it got that way is long since past. But if I'm going to clench every night and go to the side and squeeze, that's how it stays that way if I'm symptomatic. So we've got to know both things. What the patient has become, their complaints, how it got that way, and how it stays that way. If you can imagine how it got that way or how it's staying that way. Like when you see plastic with grooves in it, can you imagine if they didn't have the plastic in there? That's how it gets that way. But we don't extrapolate that. That's what we really need to be doing. So as we swirl around the cause of these signs and symptoms, there's a whole bunch of schools of thought. We're going to start with purposeful function. We need to grasp, tear, crush, chew food. That's what we need to do. That will obligate the forms that we need to do what we need to do. So purposeful function obligates these necessary forms, these shapes of these teeth. Function obligates form. The forms that we have, these molars and canines and incisors, that allows us to do things we don't need to do. Purposeless activities. We don't need to do it. I shouldn't even say function there. Just because we have them, we can do weird things. It's not okay. If you do, and here's a fantastic. Oh, I moved out of the camera. Bruxism is going to be a terrific term to look at in a few minutes about part of the TM Da Vinci Code. Purposeless function will dictate altered forms. Teeth are getting worn, joints are being the signs of the joint are sometimes not symptomatic. Signs in the joint and the disc, we start to see altered forms. And those altered forms will now modify how someone is functioning. Their teeth are worn down, their joints are strained, they have to chew differently, so their function has been modified. So this swirls around the patient's signs and symptoms. Do worn out teeth and a displaced disc cause someone pain and misery? Not all the time. You can have a ton of people like that. Guys, their teeth are worn flat, they feel fabulous. What if someone says, well, I think your function is improper. I put you on the Dealey Baba and your closure is too fast. You're functioning improperly, so you're getting fatigued. That happens out there. I don't think that's it. You don't have the necessary forms. You're not in a proper class 1 occluding scheme. I think that's your problem. I had to change that. What if you got this pathophysiology? I think that's where it is, because we can't imagine it. We don't think, oh, that would be weird if they did that. Hello? That would be weird if they did that? That's the diagnosis. That's weird. That's where we need to focus. So this TM Da Vinci Code of bruxism, we take that way too casually. Bruxism, clenching and grinding your teeth. I mean, in the neurology clinic, they used to think of bruxism like, who cares? What? Yeah, so you put a thing in their mouth, they grind on it. What are you talking about? No, you guys, it's way different than that.